Not only Nigerian, we have the stigma issue, the problem with you know. So people are afraid to come out and seek for help. They are even afraid to tell their spouses what they're feeling. This, for example, women who are having children, postpartum depression is real. It is so real that people in our community, they do not understand it at all. We've seen in the news women who have had babies and they kill their babies. Why? Naturally, you love your children, your babies to death. Why would a mother who went through all that, pregnancy, decide to take the lives of their children and herself sometimes? So even our fathers, our men, they need to be very, very aware of what's going on with their wives, with their sisters, with their daughters. When it comes to boys and men, they are even worse in terms of opening up. The machism is a preventive thing that doesn't make them to open up. Even to their wives, they be struggling with issues. And you know so many things that they say, men don't cry, real men don't cry. Heck no, they are supposed to. If they feel it, they're not supposed to suppress it. If you're a man and you have deep feelings, negative feelings, and you feel like crying, you should cry because it will relieve you. One of the reasons why, I'm going to say this, women live longer than men is because they don't bottle everything inside. Most women don't. They have their friends, their mothers, their sisters, even their husbands, they cry. They express how they're feeling. So you can understand. So sometimes men are not very cognitive of what is going on. When a woman is telling you how she's feeling, it's not that she's looking for attention. It's not about attention. We need to listen. Even us friends, we need to listen to what they're saying. It's not because they want attention from you. It's a cry out for help. So we need to be very aware of what is going on amongst ourselves. Women, we have a lot of responsibilities. We're working and we are also taking care of the home and the families. So it can be overwhelming for women. We are also part of the breadwinners. We support our husbands, our households with our finances. So we have a lot of things that we're dealing with. So we need to be able to have outlets, positive outlets. This room, I know the congregation of this church is very, very hard. So our women probably do not understand the magnitude of the issues that we have. And not only us, our children, our husbands, our brothers, our sisters, our friends. I will give you an example, personal example, disclosure about me that had happened when I was living in Chicago. I did not realize I was feeling so down. I had depression, but I didn't realize it. So one of my friends came to see me. It was during the day. I had all my drapes drawn. Everywhere was dark, and I was not. Self-care was, I would take the kids to school. I would drive them to school, I'd come back home, and I would bury myself in my bed. I was not hungry, I didn't feel hungry. All those symptoms. But I wasn't in this field at that time. I didn't know. So she came over, and she knocked the door. When I opened the door, she was like, "What's wrong with you? What's wrong with this session?" I was like, "What do you mean?" She saw everything. She's a friend, but she was the one that rescued me at that time. She opened all the blinds. She called, I feel like, she called my cousin. She said, you need to come over. Sister Sherry is going through something. She saw my face, my whole everything. I didn't realize it. So if not because of her and being aware that this is not right, she could have been a friend that would go and say, and gossip about me. Like, oh, you see her in the community, you think she's no. If you see when I went to her house, if you see what her husband is doing to her, if you see all those things. But that is what we should be to one another. We are our sisters' keepers. We are our brothers' keepers. So, I want to talk about accessing care, mental health care. If you have insurance, you have access to mental health. Even when you're overwhelmed at your job, even when you are overwhelmed, don't think that they will say you're not performing well. You're not going to perform well if your mental health is not in the right place. So, if you have insurance, every insurance, even if it's Medicaid, you have access to behavioral care. You will see a number in the back of your card, behavioral care. Call them and tell them you're not feeling yourself. You're not feeling the way you're supposed to feel. You feel overwhelmed, you're feeling sad. Yes, we all have the tendency to feel sad. Normally, you feel sad for a short period of time, and when that short period of time, it must not be up to 2 weeks, you have to seek help. If you're sad for a period of up to 2 weeks, you have depression, non-stop. So when we're sad, look for things that will make you feel better. Even dancing is a way, dancing in your room, in your house. Put on some music that you like and dance. Also, research has shown, and I'm glad I'm in a church talking to people of faith. There are researchers that support the fact that those who are of faith, whatever your faith is, and you have strong belief in your faith, they experience less depression than those who don't. So it's an avenue to help you. When you pray, you're talking to God. You talk to Him as if He's right in front of you, and He is. So spirituality is a very good way to also reduce your level of depression. Talk to God. Really, really talk to Him. Because He knows what you're going through, but guess what? God always wants to hear from us. He knows. He knows what you're going through, but when you talk to Him, you call Him, you beg Him to help you with your situation, whatever it is. Our children, we're always worrying about them. Women, we're always worrying about our husbands. A lot of times we don't worry about ourselves because we're taking care of others in our environment. So your own self-care, if you're not in the best state of mind, of health, you're not going to be effective in taking care of the whole world, because that's the job of women. So self-care, and I'm so happy I saw that you had distributed self-care query. So please take it seriously. What they wrote there is for you to do self-assessment. Take it seriously. Whatever is a no that is negative, figure out how to bring it to a yes. If you're not sleeping well, if your sleep is disturbed, you wake up every hour when you're sleeping, and it takes you another 2 hours before you fall asleep, you need some kind of intervention. If your appetite is too much or not enough. In most Africa, well, let me say in Yoruba land, when people are feeling sad, they don't eat, they don't have appetite. Not these days that they have so much of iyan. Otherwise, iyan jawa ni iluwa and everywhere, But I find out that a lot of the Americans, when they are feeling sad,